and thank you, Pradeep. Can you hear me?
Yeah, very much.
And
can you hear and see the slides
as well? Okay, thank you very much for the invitation and to include me into this program. So without wasting time, I'll continue with my topic. So perimetry basically, as you know, is a systematic measurement of the visual field function. And basically we are looking at the limits of the visual field and also the depth or the height of the sensitivity actually. So there's a concept of the field of vision that you're all very familiar with. When you're performing perimetry, it depends on the person who does it. So there is kind of a subjective test there. And therefore, it's very important to take necessary precautions and also understand the process and the procedure for better interpretation. And there are many barriers to the successful visual field testing which we should understand. So there are a number of factors that need to be considered while doing and interpreting visual fields. The test should be relevant to the patient and the diagnosis. The proper strategy must be used. The test conditions should be suitable, and those could be machine related, environment related, or patient related. And finally, if you have done a test, we have to use some tests of reliability to see whether the test is good or not. So regarding the first point, the test must be relevant to the patient or diagnosis. What this means is that the context in which you are doing the visual field is important. So the perimetry should be ordered and interpreted, keeping in mind why the test was done, what is the patient. To give an example, if you have a patient who has a fixation loss, then you might have to, devise a strategy where that has to be compensated for. And also if you're doing for a neurological patient, so you will do a suprathreshold test, which will be most convenient and faster and would give you the same information. So if you have uncooperative children, then you might be, test for FDT. So if you have a BRBO patient and if you're doing tests for BRBO, then you understand what to expect. So if you interpret that test in view of the glaucoma, then you will make an error. So the context in which the test is being done, that is important, and that should be known before you subject the patient to the field test. Secondly, to pick the right test. So it's very important to understand what test you want to do. So if you're most of the time from glaucoma point of view, we do standard 24-2 pattern, but you could change it depending on the requirement. So if you want to see a little more subtle defects on the temporal wedge or on the nasal steps, then you might order a 30-2 test. That's if you clinically you feel okay, there should be some visual field defects. If a 24- is turning out with normal or ambiguous, then you could do a 30-2 also. Sometimes the patients cannot perform testing, they can't sit on the machine for a longer time, so CEDA-fast is a good alternative for them. And now we also had 24-2C, which actually means that the 24-2 classically doesn't test points near the fixation. So here you will test some more points near the fixation. So if there is a central field defect which could be missed by 24-2 or 30-2, that can be picked up. So right test should be done. And also we know that what are the limitations of the test that you are doing is basically. So what we need to know is that the perimeter is actually testing certain points at a certain distance, like 6 degrees apart, typically for 24- and 32 tests. So that means there will be a lot of areas in between which are not sampled. So if there's a defect there, that would be missed. So if you want a little more testing to be done more closer, then you have to go for a 10-2 test or a macular test, especially for the central area. So use the most of the time we use the standard parameters as far as possible because parameters are all these parameters standardized for different machines depending on whether you are Humphreys or Octopus, some other machines. So there's no need to change these parameters by and large, so that all tests are consistent. They are done with the same standard parameters. So it's very useful to compare them, so you don't have to worry about them. But sometimes you might have to change these tests, so you should know when to change those tests, those parameters, which can be changed manually as well. So if your stimulus size is usually is size 3 Goldman standard is kept, but this is only works if your visual acuity is good. So if your visual acuity is bad, then you might have to change the size to a larger size or increase the illumination. So in that case, all the tests performed subsequently for that patient should be done with the same parameters. So if there is severe visual field loss, you might go for a central 10-2 program rather than 24-2 or 30-2 program. So similarly, you have to, there might be some situation you would like to change the parameters. The other thing is that the test conditions should be monitored and they should be proper. So this could be machine related. That means the calibration should be done properly. So all machines these days actually automated and you don't have to worry about the calibration, but make sure that the machine is, doing that. And the responsive equipment is very important, like, the peripherals, like you have a mouse or a, button which is not properly maintained, it gets stuck or something, and that could produce, or it doesn't record the response properly. So that can, have influence on the visual field performance. And also use the glass holder and things, the peripheral attachments properly so that do not create artifacts. And also the seating arrangement has to be comfortable. The room has to be comfortable. It should not be too hot, or cold, or, patient is sweating on the machine. So those parameters need to be controlled. So that means the environment has to be controlled. It should be quiet, optimal lighting, comfortable, and the more important is that the operator has to be understanding, friendly, and should be willing to spend some time to explain what is being done to the patient and reassure the patient about the test if the patient is not performing it better or making some errors. So the test conditions again should be monitored, like if the patient is not well or fatigued or there are cervical swelling, because there are elderly patients and they might have issues, other issues as well. So that should also be factored in. And finally, we recognize and minimize the artifacts. The patient has ptosis or patient are very small people, or there's a cataract or, cornealoplasty, something, or the refractive error, which is uncorrected. So all those factors, they can produce artifacts and they would interfere with the visual field assessments later. So they should be relied. And finally, you look at the reliability parameters. I'm sure they're going to be discussed subsequently also, but you can see there are the fixation errors. So if there are a lot of fixation errors, that would make the field, unreliable. So you look at the top corner on the left side of the chart under the 34, the set strategy, you have certain parameters which tell you whether the field is reliable or not. So you have a look at those parameters, and then that will give you reliability. So if you have too many positive errors or too many negative errors or too many fixation losses, then that, you have to interpret those results carefully. So by and large, generally speaking, if you have more than 20% losses, all of these parameters are more than 20%, generally speaking, then you have to look at the visual field, whether you want to do, you might like to repeat the test. So to summarize, visual fields are very important for diagnosis of glaucoma patients, and many factors can affect the performance and interpretation. So for proper interpretation of visual field, the context, the strategy, and the patient environment, and many other factors, they should be considered. And also finally, you have some tests of reliability given printed on the chart. They should be within those limits of acceptability. Thank you very much once again for giving me.
Thank you so much, Dr. Pandav, for listing out all the possible influencing factors when you're doing the perimetry.